Back now on Triad today, you've heard the phrase in TV and movies when somebody stands up in a crowd and says, "Is there a doctor in the house?" We have 3 doctors in this house, and I'm glad all 3 of them are here. First, my friend who's been on the show before, Dr. Golaszewski, who's Chief Medical Director for Mountain Valley Hospice and Palliative Care. He brought along 2 very special guests who are newcomers to the Mountain Valley system, but not newcomers to medicine and patient care. Dr. Alex Waite, staff physician, Dr. Don Bivins, Medical Director for the Virginia area for Mountain Valley. Welcome, guys. Good to see you.
Thank you. Welcome, Jim.
Yeah. Dr. G, I'm going to spend most of the time with you, and we'll get to the newcomers in just a second, to the young guys. Most patients receive hospice care in their own home, but sometimes that's not what needs to be done. Sometimes they make the transition to a hospice home. Where are your 2 hospice homes located?
We have one in Dobson, North Carolina, and one in Yadkinville, North Carolina, so both easily accessible off of major roads in our area.
And when is it appropriate, Dr. G, for a family to make that decision? Maybe they started out with having your folks come to their house. When is it appropriate to move to or go to a hospice home?
It's appropriate when patients normally have symptoms that can't be managed effectively in the home environment. So like you said, most people want to be taken care of at home, and that's how the Medicare hospice benefit came into being. It was created after asking Americans about their preferences at end of life, and there was a strong preference to be cared for at the end of life at home and not die in a hospital or a nursing home or anywhere else, but to still have good pain and symptom control at home.
Now, since you mentioned pain and symptom control, what kind of services are offered at each of your hospice homes?
When you go to the inpatient facility, what you get is there's a nurse there, registered nurse 24/7, so all day and all night. There are providers there, physicians or nurse practitioners, and they'll round on the patients every day, weekends and holidays included. There's a pharmacy there that includes all the medications that people typically will need at the end of life, specifically for symptom management stuff. So it's readily available to be given emergently if needed, as soon as a doctor or nurse practitioner gives an order. There's cleaning staff there. There's hospice aides there for personal care.
Really full service care.
It really is a full service hospital just geared toward end of life care for hospice patients.
And we know for a fact that, and I don't have to tell you guys, that hospice care is not just about the patient, but about the families too. So in that regard, what overall benefits are there to having a loved one in a hospice home?
You get a break from the caregiving role, which can be an extraordinary thing. So not only do you get better symptom control because of the way we give medications. When somebody comes into the hospice home with uncontrolled symptoms, they'll typically be given injectable medications, because not only are they no longer going to make the person nauseous or not be absorbed, but they're going to work quicker, and they're going to allow us to give higher doses more frequently without the dose accumulating.
Right.
So you get quicker symptom control, but you also get a break for the family in an environment that's created for not only the patient, but the family.
Absolutely. Alex and Don, same question very quickly for you guys. What drew you, after great careers anyway, what drew you to want to be at Mountain Valley Hospice and associated with it?
Well, really started in college at Wake Forest. I had a roommate who's a family medicine physician up in Virginia. He also works with hospice, and we get together every year and tells me what a wonderful way it is to give to families and patients. And so I've always been very interested in it. And I've heard just amazing things about Mountain Valley Hospice and palliative care, and what a great group, and Dr. G, what a great physician he is.
I'm going to let you echo, Don.
Well, I came out of retirement to come back to Mountain Valley.
Wow, so did I. No, I'm kidding.
But it's a calling to be to work as a physician in the hospice world. And Mountain Valley is an ideal hospice. It's a great place to work.
Well, we're treating you young guys as newcomers, even though you came out of retirement. So the next time we get you back, we'll go more in depth. Will you all 2 come back sometime?
Absolutely.
All right. I want to put something up on screen before I forget. MTNValleyHospice.org stands for MountainValleyHospice.org is the website, or you can call 888-789-2922 for more information. And to our 3 doctors for caring and offering the care that they do and taking care of patients and families, I appreciate all you all do.
Thank you.
Thank you, Jim.
Yeah. We'll be right back after this.
My mother passed away on a Monday night. My dad and I were with her. What would have been a dreadful experience at home was a blessing at the Waltz Hospice Home in Dobson. Mama was safe and comfortable. so were we. We were even able to bring our dog Gracie for a visit. From their in-home care to their hospice homes to helping us after she was gone. The people at Mountain Valley Hospice made us better people and became family.